Hey guys, it's Tammy, and I'm going to talk to you about my quality improvement proposal. And the topic is a supportive work environment related to standards for nurse staffing. My quality safety improvement proposal is to provide a supportive work environment by transitioning from a nurse to patient staffing model to an acuity-based staffing model that is based on real-time data that can influence the nurse-patient assignments with regards to patient characteristics and nursing competencies. Right now at my organization, we do staffing based on a nurse-to-patient ratio, and through my research, I found the studies indicate that you have better outcomes and increased staff satisfaction with acuity-based staffing. The aim of my project is to work with a team consisting of representatives from the frontline nursing, because you do need bedside nurses involved, nursing leadership, IT, clinical informatics, human resources, and the finance and quality departments. The thought is to develop a staffing model that provides a supportive work environment, and that can be evidenced by 0% workman's comp claims, a 25% increase in patient satisfaction scores, which would be obtained from the Press-Ganey survey related to nurse responsiveness and nurse communication, a 50% increase in staff satisfaction obtained from the National Database of Nursing Quality Indicators survey, and a 25% decrease in hospital-acquired pressure injuries. The literature I reviewed, I used 3 different databases, and the keywords that I used were acuity-based, staffing models, and quality improvement. That resulted in over 10,000 sources, but by the time I screened them based on a variety of criteria, I ended up with 81 sources. The common theme throughout the literature was the importance of developing a staffing model that was based on best practice that would provide a supportive work environment. It was evident that throughout the research that across the nation, healthcare is moving from a volume-based care to value-based care. And so the models that we have right now aren't efficient, so we need to transition to a more efficient system of staffing. There were several different models of staffing that were studied in the literature I reviewed, but the acuity-based system appeared to be the most effective based on the research. The care model that I based this off of was a relationship-based care model, which relationship-based care model is based on relationships, obviously. Relationship between the nurse and the patient, relationship between the nurse and their colleagues, the interdisciplinary team, and then also the self-care for the nurse. I mean, you have to have strong relationships in all 3 of these areas in order to be able to provide patient-centered care. The quality team that I'm going to develop or get to work on this project, obviously I've talked about frontline nurses, senior leadership, which is very important to have the buy-in and support of senior leadership before you can even think about moving forward. IT, because the technology piece of the acuity-based system, with technology we can obtain data from the internet or from the electronic medical records, so we need IT involved. Clinical informatics, again, that's the IT nursing portion of the documentation, electronic medical records. Finance is always important. We need to show the finance team the significant savings that can be associated with this, but also the cost that might be involved in this process. Human resources, because I feel like it's important to understand nurse retention, turnover, get those rates so we can compare them and show the significance of the cost of orienting new people when you have nurses that leave due to burnout, that kind of thing. And then the quality department will be involved also to help us with our metrics. So the idea is to implement a trial of an acuity-based staffing model on 2 different units in my organization, one in the critical care unit and the other would be in a medical surgical unit. And the model I would use would be the Plan, Do, Study, Act, and there'll be multiple phases of this with numerous cycles. The first phase would get everybody together and plan, look at the research, what types of systems are available, and do we have a system in our own electronic record, which we do, that we could utilize. So kind of work out all the kinks in that, what kind of data we can get, what would it take to implement it, and also, what's the documentation going to require, because it's going to be based on points will be scored upon the nurses documenting different characteristics of what's going on with the patient. So used multiple literature research to determine the best system. Then the next phase would be educate, because staff's going to have to educate it on how the process is going to work and what to expect. And mainly that's going to consist of documentation guidelines, what needs to be documented in order to make this system effective. And then the next phase would be the implementation phase. And so there'll be multiple cycles within this phase as we're planning. We'll try it, we'll study it, find out what we could do better, what we need to change, act, and then repeat. So it's a continuous effort. The quality and patient safety implementation. So the design of the study is supported by evidence-based practice as it applies to context of care, and that's based on the relationship-based care model. The emphasis is on providing a supportive work environment. And the quality indicators that I plan to track would be patient satisfaction, staff satisfaction, and hospital-acquired pressure injuries. The way we would monitor the initiative is initially we would do chart audits on all patients that were admitted to both the critical care unit and the med-surg unit, because we need to make sure that the documentation is supporting the system and the staffing. Then we would also monitor the Press-Ganey results monthly that we get based on nurse responsiveness and nurse communication. The NDNQI survey for nursing satisfaction is only administered once a year. So depending on where we're at within the year, I feel like it would be beneficial to do bi-monthly staff surveys just through SurveyMonkey, just to kind of get an idea of the staff satisfaction with the new staffing model. And then we'd also measure quality metrics and look at month to month the incidence of our happies. Evaluating the initiative, this would take place at the 6-month mark, and we will compare Press-Ganey scores, and we'll even look at trends from baseline scores to month-to-month scores to trend the scores. We'll evaluate the bi-monthly nurse surveys. If we've done the NQI survey, we'll also look at those results compared to last year, or that may be something that takes place a little bit later whenever the survey is administered. And then we'll also compare the incidence of happies. So in conclusion, healthcare is ever changing. So right now we're moving away from volume-based care to value-based care. Staffing models and decisions are a key component of the value-based care, patient-centered care. Bedside nurses are an integral part of the patient-centered care, and it's extremely important to keep the bedside nurses happy. You're going to have increased retention, decreased burnout, and then there are also studies that prove that satisfied nurses provide better patient care. They also indicate that patient outcomes and staff satisfaction improve when patient characteristics are matched with nursing competencies. An acuity-based staffing model takes all of that into consideration and matches that up, and it's based on a number system. As far as implementation in my organization, the first step for me will require a meeting with the senior leadership, which would be the CEO, the CFO, and the CNO, because in order to implement a process, I need to have approval from that group, but I also need to have their support. And so I would show them a more in-depth view of what the research showed, and also the rationale behind it, which we've discussed briefly here, but also a big component too is the financial impact, because if we're having better patient outcomes, we're going to have decreased patient mortality, decreased length of stay. There's multiple numbers of things that are going to reduce the financial impact upon the organization. So that's it for my presentation. I want to wish you all good luck in your next course, and I hope to be in the same one with you.